country to actually be clear about what your obstacles are. And one of the biggest obstacles that you're going to face is the U.S. government and the attitude that they have about harm reduction. And what's interesting to me about that is that the perspective and the attitude that the U.S. has taken about harm reduction is driven completely by a domestic debate that we're having about it. It has very little to do with what the rest of the world is doing. I personally find that really frustrating, but it is what it is. So in the U.S., the term harm reduction has been equated with legalizing drugs. And so anybody who's involved in politics or drug treatment or support services or whatever just stays away from the term harm reduction like it was the plague, because anytime you mention it, the opposition says, oh, that means that you're for legalizing drugs. But that's not what harm reduction is. And in fact, one of the things that I like to always make clear when I talk to people about this is that we all practice harm reduction every day. Every time you put on your seatbelt, every time you put a helmet on before you ride a bicycle, every time you go out at night and make sure that you have one person who's not going to drink and be your designated driver. All of those things are harm reduction. It's the things that you do that are going to reduce the likelihood of something bad happening out of activities that we all engage in every day. So I think it's really important to just start with a fundamental of what it is that we're talking about. Now the reason that in the U.S. and people who are pro-drug war don't want to talk about harm reduction is because harm reduction goes straight up against the philosophy of just say no to drugs. And that if you repeat saying no long enough and everybody buys into that, that you won't have a problem. But again, the thing to me that's really important to understand when you're talking about issues around drugs is that we are all drug users. We may not all be illicit drug users, but we are all drug users. I cannot function without my cup of coffee in the morning. That is a drug. It's caffeine. It stimulates me in the same way that if I were taking Ritalin or cocaine or any number of other stimulants, it is a drug. For people who use a lot of sugar, sugar is a drug. I mean, and I'm not even getting into all the pharmaceuticals that people use all the time. So, you know, we live in a society and in a world that's made this artificial distinction among drugs, that these drugs are okay and these drugs are not okay. Now, as people of color, I think it's really important to understand that the decisions about which drugs were not okay were driven as much by racism as they were by what's dangerous. If we were doing it from a purely scientific point of view, with respect to what drugs cause the most harm for people, then the 3 drugs that would be illegal would be alcohol, tobacco, you know, first and foremost, and then you'd look at some of the other drugs in terms of how many of them kill people, how many of them hurt people, and yet those drugs are legal. All of the illicit drugs altogether don't cause the amount of harm that those legal drugs do. And there is not yet one reported case anywhere in the world of people dying as a result of using cannabis. Okay, so I just really feel like it's important to start with some basic facts about what we're talking about. So part of the importance, I think, of Youth R.I.S.E. is that my generation and the generation before me grew up with a lot of misinformation about drugs. And they've developed bad policy based on bad information. You guys have the opportunity to actually be the instruments for developing good policy based on having good information, accurate information, truthful information. So, you know, I think that the whole concept of harm reduction exists on a continuum. The place where you start, I hope you don't mind if I use this. The place where you start is in the whole concept of prevention of the use of drugs, and that I think is a really good place to start. But the place that you want to go to, you know, in this continuum of harm reduction is helping the person who is a long-term drug user, whatever drug it is, to live a healthy life without hurting themselves and other people. And all within this continuum are all the different kinds of activities and interventions that you can develop. But let's be clear that the continuum should include all of this. See, in the U.S., we reject this. We're like, this person doesn't count. all right? So that's why 25 years into the HIV epidemic, we wouldn't fund needle exchanges for people, even though we knew that not having it meant that people were going to acquire HIV and hepatitis C and die. Because there are places in the world where people are so committed to this that they're willing to see people die in order to maintain the illusion of this. And yet this is an illusion because we're all drug users. And so the question is, do you want to prevent problematic drug use, or do you want to prevent all drug use? And I think that as leaders in the community and people who care about people, that what you want to prevent is problematic drug use. Understanding that to the degree that you can prevent drug use, period, then that's the first step towards preventing problematic drug use. And yet every survey, I can only speak for my country, but we've had drug prevention programs in place now for more than 30 years. And yet consistently, 50% of all young people say that they have tried some illicit drug by the time they've gotten to the age of 21. So clearly, in spite of all the stuff that we're doing and all the money that we're spending, there's still a significant portion of the population for whom they're like, hey, I heard you, and I'm going to do it anyway. So what do we have in place for them? You know, I mean, to me, that's reality. I mean, yes, there are many factors that contribute to people using drugs, like homelessness, unemployment, etc. But to me, the #1 factor is being young, is wanting to experiment, is wanting to try things. And you know, when I was growing up, you could do that and not have it ruin your life. Okay, there were many, many people that I grew up with who tried all different kinds of drugs, and most of them were able to go on and have decent careers and decent jobs, etc. But now, we live in a time where through law enforcement, your life choices can be permanently altered as a result of those kinds of decisions. And I'd like to use our current president as an example, because in his first book, Barack Obama wrote about the fact that when he was a young person in college, that he experimented with both cannabis and cocaine during a period of his life when he was troubled and trying to find himself. Now, if he had been subject to the same kind of law enforcement tactics that many young people in poor neighborhoods are subject to, he would never have had the opportunity to become a lawyer. He would never have had the opportunity to become an elected official, and he certainly wouldn't have had the opportunity to become president. And that wouldn't only have been a loss for him, it would have been a loss for all of us. So for me, one of the reasons that I'm committed to this work is because I believe that many of the young people that I see getting arrested every week, going to jail, are the future Obamas, are the future, my Governor Patterson, who also acknowledged having used drugs when he was a young person, or my mayor, Bloomberg, who also acknowledged having smoked marijuana and liking it. Okay, and so my bottom line is that I'm not speaking for or against drugs, but what I'm saying is that people having an arrest record, being incarcerated, is more harmful to them in the long run than their experimentation with drugs as a young person. And if you can provide people with the support that they need so that they can avoid having problematic use, so that they can have access to help them stop so that they can learn the signs. Like, we don't teach young people how to know when what starts out as an experiment starts to become a problem. How many people know that? I'm hoping that you guys will look at how to develop a form of cannabis harm reduction education for Nigeria. Since this is the #1 drug that people use here, how can you begin to educate young people about, if they're going to do it, how to do it safely, how to avoid problems, how to have it escalate from that to another drug, how to not mix it with alcohol? Because in the long run, what you want is for people to be safe, for people to be healthy, for people to be able to have a productive life. You all to take, because to me the U.S. is a prime example of everything not to do about drugs. Seriously. It's like, look at our history and look at what we've done around drugs and do the opposite, and you'll have a much better outcome. So one of the reasons that we had a crack epidemic in the U.S. is because of the suppression of cannabis for a long time, where our government went and sprayed cannabis in Mexico that was on its way to the U.S. so that people were afraid to smoke it. So then when other folks came along and said, here, try this thing that you can smoke, which was a hell of a lot more dangerous than the cannabis, people went for it, and all kinds of problems occurred. There is a relationship. It's like when you decide what you're going to do about one drug, you have to think about what impact that may have with respect to other kinds of drug use. Okay, and how can you educate people? Now, to me, the most important thing that I saw that happened around crack was not all the stuff that the government put out. It was the information that young people put out in their music. You know, my son grew up during the time when crack was ravaging through black neighborhoods in the United States. And we lived in Brooklyn, which was crack central for New York City. And him and his peers all saw, by looking around them, their slogan for his entire generation is crack is whack. That was it. You could not get, none of his friends had any interest in having anything to do with that drug. And they saw the people who were using it as being bad people and people who were messed up. Now, quite frankly, he has issues with the fact that I've made a choice professionally to actually try to do stuff to help these people. He's like, why are you helping them? Nobody helped me. But the bottom line is that people learned from the experiences that they had around them what was dangerous and what not to do. And the music that they produced was very important in getting that message out. So one of the things that I really wanted to suggest as part of the program that you develop here around harm reduction is to look at ways to, I've been able to be on TV and listen to some of the local rappers and hip-hop artists here, which I see that people are into it the same way that they are everywhere else in the world. I think that you want to find ways to use hip-hop, to use poetry, to use people's cultural expression as a way of educating young people about drugs, educating them about services, educating them about where they can go to get help. You don't have to, I was listening to what people were saying earlier about the fact that many of the vulnerable youth are not that educated. Well, they do listen to music. They listen to the radio, they watch ads, they go on YouTube. You guys could produce videos, 5-minute videos that you can put up on YouTube that can tell people about Youth R.I.S.E, that can tell them about basic health information and how to get more information. You can use music, you can use poetry, you can use social events as an instrument for educating people. And not just young people, but also educating older people, educating parents. Because again, I mean, in my work around cannabis harm reduction in the States, one of the most controversial things I did that I still get flack from sometimes was going into the community and saying to parents, look, you know the cops are out there looking for your kids. You know your kids are smoking weed. Why are you pushing them out into the street for the cops to pick them up? If they're going to do it, let them do it in the basement where the cops are not there. You may not like it, but at least you know that your child will be safe. At least you know that they'll be out of the clutches of the police. I wasn't happy. You know, my message to my son was, I don't want you to do drugs and I don't want you to have sex until you're old enough to be able. I'll tell you, my bottom line message to him was this. If you're going to use drugs, but don't let drugs use you. So you need to be old enough to understand what you're doing and to manage what you're doing so that it's not using you. I didn't want him to have sex until he was old enough to be responsible about it. But when he decided he was going to do it, I was like, okay, bring the girl home. No, seriously. And it's not the most comfortable thing as a parent to know that your child is down the hall having sex. But at least I knew where he was. And I knew who he was with. And I knew that he had a condom because I gave him one. Okay? And I mean, to me, that's what harm reduction is about. It's about acknowledging the reality of what people are doing in their lives and supporting